And going to the dentist can save your teeth, but could it save your life? Well, you might want to keep that next appointment.
Coming up next, what your smile says about how healthy you are.
And now you know that a routine dental exam is good for your smile, but did you know that it could also save your life? Health problems everywhere, from your liver to your bones, can leave signs in your mouth. Dr. Gregg Lituchy is a cosmetic dentist here in New York. He joins us now to explain what your oral health can reveal about your overall health. Good to see you.
Nice to be back.
So your basic point is that the mouth is full of clues about possible disease.
Exactly. You have to think of the mouth as the window, looking into the window of the rest of your body as far as health goes. 90% of systemic diseases in the body show up as oral manifestations in the mouth. So as dentists, we just can't concentrate on the teeth, even though that's what we like to do. We almost have to be detectives and look in the mouth and see what else is going on there.
So what are the kinds of things you're looking for exactly?
Well, for example, you could look at the color of the gums. In somebody who has fiery red gums that just don't heal, well, that could be a sign of leukemia. Or somebody whose gums have a yellow tinge to that, that could be a sign of liver disease. Patients who have diabetes have terrible periodontal disease and bleeding gums in their mouth too. So you have to look at the gum.
So bleeding gums are always a problem. You should go see someone if you've had an issue with bleeding gums.
Absolutely. Bleeding gums are very important because if you don't take care of your gums, the bleeding gums could eventually lead to bone loss and tooth loss.
But the teeth themselves also tell a story.
Yeah, I mean, if you look at someone's mouth and you look at the enamel, if I see that the enamel is eroded off the teeth, well, that could tell me one of two things. It could tell me that the patient is bulimic from throwing up the acids from the stomach, actually erode the enamel off the inside of your upper teeth, but it could also tell me, well, maybe the patient has gastric reflux if they also have a sour taste in their mouth or a burning taste in their mouth. And
when the tooth itself, not just the enamel, when the tooth itself is starting to erode, that sets you in a different direction.
Right, let's say you have bone loss around your teeth. Well, is it just in your mouth? Or does that mean you have bone loss somewhere else in your body? Do you have osteoporosis? You know, if you have pain in your temporomandibular joint, yeah, you could be somebody that grinds your teeth, but that could be a sign that you also have rheumatoid arthritis somewhere in your body as well.
Now, these are a lot of scary diseases you're throwing out there. Is this the kind of thing I can imagine people at home going now, looking in the mirror and saying, oh my gosh, I've got this?
No, you don't want people looking in the mirror and scaring themselves and pointing to every little spot in the mouth and saying, oh my God, I have mouth cancer. I mean, as a dentist, I know that the three most common places of finding mouth cancer are going to be the lower lip, under the tongue, and the back sides of the tongue. A patient wouldn't know that. The patient's responsibility is to get into the dentist, get there twice a year, so that the dentist who's trained to look for these things can check you out.
So we know that the gums and the teeth can give clues to possible diseases, but does it work the other way around? If people take great care of their teeth, brush, floss, rinse every day, can that lead to better health overall?
This is what's so fascinating. Recent research is showing that there's an association between the health of your mouth and the health of your body. That's working in the opposite direction. In other words, inflammation in the mouth that can lead to periodontal disease, they feel is now associated with inflammatory processes like heart attacks, strokes, diabetes, and preterm labor.
What's the link there with preterm labor?
We don't know the exact link, but what the theory is that bacterial toxins in the mouth travel in the mouth through the bloodstream to the placenta, to the mother, to the fetus, and that causes labor to occur earlier than it naturally would.
So this certainly would matter for pregnant women, but your basic message is also that prevention, taking good care of your teeth, is a great investment.
Exactly. Listen, we're a very health-conscious society. Look, we're on the treadmill for an hour a day. We go to the vitamin stores to eat healthy. We go to the health food stores. It would take 1 minute a day to floss, brush twice, rinse with an antiseptic mouth rinse just in case you're not getting all the bacteria out of your mouth from flossing and brushing alone, and visit your dentist twice a year to make sure that everything is okay.
So the same things your dentist tells you all the time about your teeth really are going to work for your whole body.
Yeah, I mean if you realize that taking care of your mouth for that 1 minute could really affect your life, you know, your chances of getting a stroke or a heart attack. You know what? I'm not taking that chance with my family or with my patients. I'm making them aware of it now, even though the exact mechanism isn't known now, and it may be 20 years before we find that information out. If we know there's an association, I'm taking care of my patients.
Dr. Lituchy, thanks very much.
Thank you very much.
Thank you. And we'll be right back.